contracts. And so we saved over $500 million for the state months ago to cushion potential impacts from the economic revenue reductions because of this pandemic. I'm glad we did those things. It has set us up a position now to move forward to continue to help struggling families in our state. So working with the legislatures and stakeholders, we got $2 billion in CARES money out to local communities very quickly. The funds supported public health and hospitals. Businesses needed assistance and got it, and for help for the immigrant community and rental relief. But those federal funds are almost depleted, and the new relief package, likeliest to pass Congress, does not provide, and we're very disappointed by this, relief for our states and local governments to help in their services. That's why we will be working with the legislature to approve legislation early in the session in January for another $100 million to help in small business grants, particularly with those businesses that have had to close some of their services because of the pandemic, and an additional $100 million in rental assistance to help folks on both sides of the equation. Now, even after that short-term work, which we hope can happen in the first days of the legislature, we have a lot more work to do. So we know the fight against COVID is not over, and our budgets must reflect the need for strong, robust, and comprehensive economic recovery for our state. I know people are hurting, and I understand that. I've heard it from business owners, from workers, from families. We know that this has been profound. Just to give you a sense of what this means, what the pandemic has meant, I'll just refer to this graph. This shows the job losses in reference, in comparison to other big recessions we've had in our state. The lines as they dip down show the percentage reduction in jobs. And you'll note the most recent was 2008. Dark line, then we have the green in 2000. But you look at our pandemic, what it did to our economy, which is it cratered it with this vertical line going down, got down to about 11.5% reduction of employment. It is coming back up, we're happy about that, but it's still substantially in the zone that is the most severe job loss that our state has experienced for decades. We have another graph here to show, however, we just want to show there's always some good news. And even though we have had huge impacts on our economy relative to other states, we've done fairly well. This shows the reduction in economy of Oregon in the gray line, which is had the biggest job loss, then the average for the United States, which is the kind of light blue line, and then we have the red line, which is Washington. Our job losses have not been as profound, and we are coming back. Idaho is coming back a little faster than you, actually about the same slope, but relatively compared to other states, we're doing relatively well. But that doesn't mean we should not act. We need to act. We need to act with vigor and resolution to help the recovery of the economy of the state of Washington, and we are going to do that. So COVID has caused an economic crisis hand in hand with the health crisis. It shut down business activity. It has forced unprecedented spike in unemployment. The challenge faced by small business owners and working families has been profound. It's touched every corner of our state. So now is not the time to make cuts to the provisions of the state that help our families and our businesses. We must rebuild the state's economy through stimulus and continue efforts to support households, students, workers, and businesses that have been impacted by the pandemic. And while we do this, we have to address the racial and economic inequity in all that we do. I want to address the strain on our unemployment insurance system, which has been great. Small businesses who had previously never really had layoffs have had to shut their doors, and the result has been a huge spike in rates. I'm proposing legislation to substantially reduce the burden of these unemployment insurance taxes on businesses and help ease businesses through this transition period in which many are still struggling with COVID-related shutdowns. In total, these business assistance efforts will result in a reduced tax burden of $790 million in the year 2021 and total $1.9 billion in assistance through reduced taxes through 2025. Just to give you an example of what that means, for example, under current law, an employer with 50 workers who had to shut down at some point in the crisis would have a 2021 tax bill of $49,000. This proposal reduces those taxes by 37% to $31,000. It's a way to help our business community. The workers have struggled too, obviously. So my budget invests for the first time in the Working Families Tax Credit. And I'm investing in additional claim staff, including more dual language agents, to ensure timely access to the benefits workers need, as well as increasing the minimum weekly benefit amount for unemployed workers. Had policy been in place in 2020, it would have meant increased dollars in the pockets of 312,000 unemployment insurance claimants. By the way, our investment in the Working Families Tax Credit is important. This was created years ago but never funded. This now will put dollars in the pockets of lower-income working families, and that is the right thing to do. The COVID crisis has also demonstrated other new workplace concerns. Workers have faced retaliation at times, even for making legitimate health complaints during the crisis. And I propose we address this problem by increasing protections for workers who face repercussions for raising health and safety concerns. My budget increases staffing in the Division of Occupational Safety and Health, a critical resource for workers and employers to understand safety protocols on the job and ensure a timely response. We'll also initiate rulemaking for an infectious disease standard to further protect workers from the risk of these hazards on the jobs. Now, to talk more about our economic recovery and workplace safety efforts, we're joined by two more distinguished guests, Senator Karen Kaiser and REI's Director of Retail Operations, Dom Morell. Senator Kaiser, thanks for your leadership. Looking for your comments.
Well, thank you, Governor, for your leadership. And I'm very happy to speak for both of these proposals before us today. You know, this crisis that COVID has brought to us means that we have to rely on the strength and resilience of all of our safety net programs. I am so pleased that Washington State's programs for unemployment insurance and workplace safety have been resilient and have held up. But the pandemic has also revealed where our system does need improvement, and your proposals address that. Of course, we have to make sure that the trust fund in unemployment insurance remains healthy. When we started this crisis, we had something like $4.8 billion in the trust fund, one of the best in the country. We've spent down now to under $2 billion. We will need to rebuild that. We also need to take really prompt action early in the session to address the unemployment insurance premium increases that are coming down if we don't take action. So I especially am happy to see that proposal, especially to address those small businesses in the hardest hit economic sectors such as hospitality. So this legislation will both reduce the spike in unemployment premiums, and the other thing it does, I believe, that will help so many people is it increases the minimum weekly benefit for the lowest wage earners. And then on the workplace safety side, that is also where we need to really address the fear and anxiety of tens of thousands of Washington workers, frontline essential workers, from bus drivers to grocery store workers, childcare to nursing home workers. They have real concerns about their safety and the safety of their families when they go home from work. Many of these workers are especially vulnerable because they're in low-wage direct service jobs, and many are also people of color who have higher rates of COVID infection. So they have real issues that need to be addressed, and your legislation will protect them from retaliation if they speak up and complain about the safety standards in their workplace. And it will also provide for safety grants to small businesses so they can improve the workplace safety standards in their workplaces. And then, most important perhaps, is it prepares us for the future with this approach through labor and industries to establish an infectious disease standard for the workplace. So together, these two bills you propose take big steps to strengthen our safety net and for both workers and for businesses. You know, we've learned a lot during this awful pandemic, but we're not just planning to do better next time. We're going to do better now. Thank you.
Thank you.
And with that, I would like to pass this on to Dominique Morel, REI.
Go ahead, Dom. Hope you're not muted there. That happens to the best of us. Do we have Dom there? Dominique, we're not hearing you quite yet.
Can you hear me now?
Yes, that's great.
Thank you so much.
Thank you.
Once again, my name is Dominique Morel. I lead the operations responsibilities for our stores for REI Co-op. In a nutshell, we design and deliver safe and effective operational plans for our retail stores across the country. And like REI, businesses have faced so many new challenges brought on by the pandemic. When the epidemic started, I was designated as a lead for our company to design and roll out safety protocols for the stores. It was an enormous lift, and ever since, my team and I have been heavily involved in supporting safe store operations throughout the pandemic. Needless to say, this experience has been both humbling and an honor. The experience has stirred in me my greatest appreciation for the hard work and tireless efforts of frontline and essential employees. And I'm most inspired by their strength and resiliency, as well as the support we've all shown each other in our communities as the months have passed. It's also been an honor to share my and the co-op's experience with colleagues from around the state. In May, I was asked to join one of 3 advisory groups to Governor Inslee. Our task force was made up of worker and business representatives, and we convened listening sessions with a range of stakeholder groups. They included Main Street business owners, bankers and community leaders, and more. Our goal was to understand the challenges COVID-19 shutdowns have had on our local economies. The feedback we got from this outreach helped the Department of Commerce in targeting relief grants and engaging trusted messengers to reach traditionally underserved businesses most in need. We helped the Commerce Department with the formation of the Washington Recovery Loan Program, set to launch early this coming year, to provide access to credit for those without traditional banking relationships. It was great to hear Governor Inslee's commitment to equity this week and his support for strengthening economic resiliency networks that can expand the state's relationship with minority-owned businesses. Equitable access to economic support was a common theme of our advisory group's work as well. As the governor has said today, this is all interconnected. Economic recovery depends on a strong social safety net, financial relief to hardest hit industries, safe workplaces, access to childcare, and trusted communicators ensuring access to all. On behalf of the advisory group, I want to say thank you for the opportunity to serve the state. And Governor, thank you for you and your team's efforts.
Dominique, thank you. You epitomized the great business leadership we've had from so many business leaders that have helped lead us through this. And REI has been a perfect example of that. Karen, thanks for your leadership. You've been one of the earliest voices for this effort. And it's great to be allied with you. We do know that this is all linked, and a very important part of our economic recovery is our healthcare recovery as well. And it is very clear that we need additional resources in public health. So our budget includes $397 million for resources for Washington State, the resources we need to pull us through this pandemic. This includes funding for some of the things that we fought for before the pandemic: personal protective equipment, testing supplies and lab coats, or costs, contact tracing and resources to continue to be able to work the logistics of the distribution of this vaccine. But we also need longer terms that's available long-term for our healthcare system. So we are proposing a new revenue source to meet long-term public healthcare needs and increasing our ability to confront future healthcare crises. The funds include investments in data systems to better track and analyze disease cases and hospital capacity. The budget also funds partnerships that build trust between the states and the local health leaders. And the revenue for these programs will come from a new assessment on health insurance carriers and third-party administrators. It really is time to provide our health insurance system with stable, predictable funding, and so we are proposing that. We've also learned a lot about how to organize our healthcare response. We have found that there's profound disparities when it comes to resources and decision-making across our state between counties. So we believe health districts can be more effective in addressing the needs of multiple adjoining counties and focusing on the best public outcomes for their communities. Therefore, I'm putting forward legislation that will create regional coordinated approaches to local public health through comprehensive public health districts, combining services across counties in regionalized health districts will lead, I believe, to a more efficient, consistent, and equitable public health benefits. To speak more about the importance of this effort, I'm joined by June Robinson and Representative Marcus Riccelli. Senator. June, do we have you there?
The governor's office got muted, y'all.
So we were muted somehow. How far back were we muted?
Just the introductions.
Okay.
So just, yeah.
Thanks for the assist, John. That's the kind of great leadership you're providing for us. I appreciate that. We have two great legislators, June Robinson and Marcus Riccelli, with us. June, we'd love to hear your thoughts about these efforts.
Well, thank you very much, Governor Inslee. It's such a pleasure to join with you today as you roll out this really significant investment in stable and long-term funding for foundational public health. I know as a public health professional and as a legislator that this funding is desperately needed. The past year has shown us how important a well-resourced public health system throughout the state is. And we've unfortunately been stymied at times in the last year by staffing issues and by infrastructure deficits, as you pointed out. Local public health jurisdictions across the state have been chronically underfunded, and as a result, we've seen staff who are working overtime and are getting burnt out. We've seen data systems that don't always connect to each other and don't give us the timely and nuanced data that we would all like to have. So stable funding will go a long way towards correcting these deficits that we have experienced.
June, thank you.
It also is important, as you are proposing, that along with the funding, we take a good examination of the structure of local public health across our state. And we want to move into and be thinking about a post-COVID world and what kind of structure do we need both at the local level and at the state level to really support the people of Washington and their public health needs into the 21st century. We want to be better positioned and better prepared for the next public health emergency. And we want to stay focused, as you are, on community, on public outcomes, and on science. And I believe that your both policy and funding proposals will help us do that. I really look forward to working with my colleagues in the legislature and with you, Governor Inslee, to advance these proposals in the upcoming legislative session.
Well, thanks, June. Great to have an expert engaged in this effort. Representative Marcus Riccelli from Spokane. Marcus.
Thank you, Governor, and thank you, June, for your leadership in public health and the legislature. Our current public health system isn't working for everyone. Rural and underserved communities need help, and we've seen firsthand in Spokane what happens when politics is put over public health in a pandemic. It's time for us to recognize that diseases don't care where you live or what county you're in. By creating stronger public health districts focused on accountability and effectiveness, this will help make sure that our public health system is serving everyone in Washington State. I want to thank Governor Inslee for putting public health and people first in these difficult times and for bringing forward a roadmap for structural change for a healthier Washington. We know public health is our first line of defense, and people suffer when it's underfunded and inefficient. Everyone deserves a fair shot. Everyone deserves a fair shot to thrive, regardless of their zip code. Eliminating large health disparities is vital for Spokane and for communities throughout our state. I look forward to working with you, Governor, and working with Senator Robinson and our colleagues and public health professionals across our state and our communities to bring forward these needed changes. Thank you.
Thanks, Marcus, for your leadership. I know you've been a very vigorous advocate for sensible decision-making in your community, and thanks for being a leader on this. I want to address our homelessness issue, which I know has been so frustrating and concerning for so long. We've had housing challenges now for years. Every year we have built additional houses or housing units by the hundreds and thousands. We put hundreds of millions of dollars in additional funding every year. And we were starting to make some marginal progress on this problem, and then boom, we got hit by the COVID pandemic. And now we know that has exacerbated the challenges for people to live in healthy conditions. So the economic fallout certainly has intensified the homelessness crisis, and we have got to increase our commitment to it as a result. With many thousands of Washingtonians still struggling to pay their rent or mortgage, I'm proposing significant new funding for rent and foreclosure assistance and other measures to prevent homelessness. My operating and capital budgets and the early action legislation I'm proposing include more than $750 million to help the state's homelessness crisis, as well as our mental health crisis, which is associated with this, as we know. Those have both been compounded by the pandemic. We're going to build more affordable housing units. We are going to preserve, and this is important, existing housing stock. And behavioral health is also a priority, obviously, not only for its own benefit, but to try to reduce the homelessness crisis that we have in the state of Washington. You can't do that rhetorically. You have to do that with investment, and we are proposing that investment to get that job done. The pandemic has also caused major disruptions for families and students. So I am also proposing significant new investments to expand learning opportunities to help get our students back on track. My budget also focuses on equitable student supports, such as providing broadband connections for families who cannot afford internet. So my K through 12 budget includes $400 million to improve educational outcomes for all students and to address learning loss and educational opportunity gaps. Our educators have been working so hard in this remote learning environment. They have been incredibly innovative and amazingly dedicated to their students. But we have to realize that this has created challenges that many students have had a learning loss as a result of this pandemic. And this is an investment I'm proposing to find a way to help the students who need this help because of this pandemic. I've also proposed we increase staffing levels for counselors in elementary schools for students who may be falling behind academically and needed trusted adults. Child care providers have also been hit hard by the pandemic. Since spring, I've improved using nearly $191 million in Federal CARES Act funding to support child care businesses and help low-income families afford child care. This budget continues these efforts. We know that safe care for our youth is an essential component of our total economic recovery. Women have left the workplace in record numbers to fill the gap from school and child care disruptions. These investments will ensure we're not turning our back on the important gains for women and all of us in our economy. Also key to our economic recovery will be rallying the state's resources and partnerships to help those impacted economically by this crisis to get their lives back on track and ultimately into sustainable family wage jobs, which is why I'm making investments in multiple workforce training programs to shore up these resources. Now, the dollars to do this, these things that are necessary for our economy, for our families, for our kids, does not grow on trees. Got to come from somewhere. We know that. So the reality is that even though our budget picture has improved since spring, the state still faces significant fiscal shortfalls. Besides dipping into reserves, my budget relies on savings in a number of areas. I propose reinvesting some of those savings into critical needs while using the rest to balance the budget. So as we face these revenue challenges, while Washingtonians with lower incomes pay more of a percentage of their income in taxes than the wealthiest Washingtonians, this is unfair and it will not help our economic recovery if the old system continues. Compared to most other states, our tax code is wildly regressive, wildly unfair. If I can just share some information about that, why the status quo is unacceptable. This chart shows the relative percentage of your income that different income levels pay in our state. So if we look at the top 1%, the wealthiest 1% is the bar on the right of this light blue graph. And that top 1% pays about 3% of their income in taxes. And as the income levels go down, the percentage that they're paying goes up dramatically. So the top 1% is paying about 3%. The bottom 20% is paying 17.8% of their income in taxes. 17.8%. So the bottom fifth of our citizens are paying 6 times more as a percentage of their income than the top 1% of the ultra wealthy in our state are paying. This is grossly unfair, grossly unacceptable, and bad for our economy. Because when people can't afford to buy a pair of shoes, they don't make very good consumers and businesses don't thrive. So we need to put more money in the tank to keep this recovery going, and we need it to do it in a fair way for Washington citizens, and that's what we're proposing. So the state does need additional revenue to continue to strengthen our state's pandemic response. This we know. And we have to make sure the recovery effort also protects previous investments that we made in state services. And as I have in previous budgets, I am proposing a capital gains tax on the sale of stocks and bonds and other assets. This would not apply to sole proprietor businesses, retirement accounts, homes, farms, or forestry. And this is important. Earned income, wages from salaries are not capital gains and would not be taxed at all. The tax would remain zero on wages. This proposed tax change, which will not go into effect until the second year of the biennium, would raise more than $3.5 billion over 4 years. And it would only apply to less than 2% of Washingtonians. The average earnings of the people who would affect, those less than 2% of Washingtonians, their average earnings is about $750,000 a year. This is a very select group that we are asking to assist our families during this pandemic. So with the tax geared to very large capital gains and only a tiny fraction of the state's wealthiest taxpayers, we know it would be a small group affected. So in that regard, it won't worsen Washington's dubious distinction of having the nation's most regressive, most unfair tax system, which is an upside-down tax system that disproportionately impacts people at the lower end of the economic spectrum. And I do want to note, if the legislature decides that is not the appropriate way to fix this outrage, I am open to other fair, progressive systems that might be available. And there have been discussions of other means to simultaneously raise money for our health system in our schools and also bring a little modicum of fairness to our system. And I'll look forward to listening to legislators' ideas. So I'm also proposing investments that are important that can put people to work. I am proposing a capital budget that will help stimulate economic growth while addressing our infrastructure needs across our state. And I believe we should tap future bond capacity now and take advantage of very low interest rates to help stimulate the economy and put people to work, particularly in construction jobs. This would start work on projects earlier than projected, and it will support an estimated 36,000 jobs per year statewide over the biennium. The budget sends $150 million to the state's public work assistance program, which provides low or no interest loans that local governments can use to repair everything from bridges and roads to water systems. The capital budget also includes money for school projects, funds to design work and site demolition for a new 350-bed forensic psychiatric hospital at Western State Hospital, and funds for a new 120-bed nursing home facility to care for clients with intellectual and physical disabilities. We cannot ignore the needs and the benefits of a strong, sustainable investments also in our transportation system. In the next biennium's transportation budget, the state will make major progress to meet a federal court injunction to remove culverts that block habitat for salmon and steelhead. It provides $724 million that will help the department design 136 barrier removal projects and construct another 114 projects. This is good for people who like to fish, and it's also good honoring our constitutional obligation to honor our agreements to improve habitat for salmon. The transportation budget also includes $400 million for preservation work on our state's transportation infrastructure. And it continues the state's efforts to reduce greenhouse gas emissions by investing in clean transportation, using a system of cap and spend regulations for carbon emissions in transportation. So just to wrap up, because I'm looking forward to your questions, I do want Washingtonians to know that our focus here is to recover our economy, to reduce the economic impacts on our families, and set us up for future growth. And I believe making investments, continued investments in all these programs that people need will help them through these times. This is a moment to invest in ourselves. This is not a time for penurious budget cuts that reduce services to Washingtonians. It is not a time to throw Washingtonians out on the street. It is a time for investing in our families. It is a time for relief, recovery, and resilience, and our budget will accomplish those things. With that, we have OFM Director David Schumacher, Director Susie Levine, and Health Secretary John Wiesem, who are also available questions. And with that, I will get a sip of water, because this is a big budget, and it's been a long speech, so I'm looking forward to your questions.
All right. Up first, we'll go to Rachel LaCourte with AP. Go ahead, Rachel.
Governor, our capital gains tax has not been able to pass the legislature in previous years and is certain to face a court challenge even if it does get approval this year. So why go this route again instead of looking at other revenue options? And I was going to ask this of the House and Senate members, but I see they jumped off the call. So have they told you if they have the votes in their caucuses for new revenue?
Yes, I believe that this will pass the legislature this year. I think that is a likely result. And the reason is two things. Number one, we understand we're in the middle of a pandemic and we simply have to have relief for our families. We cannot throw people and kick them off to the curb in the middle of a pandemic. So additional revenue from some source is absolutely necessary this year. And it is clear that if it is going to be raised, it should not be on the poorest amongst us, We have enormous wealth in this state, and this is a very small ask of the most wealthy folks in our state. This has broad recognition of this particular revenue source, and I believe it's the most likely to pass because of that, because we are familiar with it. And the desire for economic justice is just become to a boiling point in our state, and that is reflected in legislators' belief on how they want to handle this. Now, there are some other alternatives that they may consider so that revenues could be raised and not on the backs of working people. And as I've said, I'm open to those, but it's my judgment this would be the most likely thing with the most sure path across the legislature, which still assures fairness in the ability to finance our schools and our health system and everything else. And we've had a couple new infusions of new blood into our legislature, and I welcome those new legislators who are Democrats, who are ready to hit the ground running when it comes to fairness. And so I think all of those things together, meaning that I think this could be the year to make this step forward. And if not now, when? When will we ever improve the fairness of our tax system, if not this year, when the pandemic has exposed massive economic inequality, a desperate need for funds for our children and our own health? This is the year to move forward in the state of Washington.
Okay. Up next, we'll go to Joe Sullivan with the Seattle Times. We're going to try and do a run through with all of the folks who have RSVP'd for a first question to start with. So go ahead, Joe.
Governor, I'd like to ask about your budget, but I need to ask Secretary Weisman today, since the Department of Health has not responded to our questions about the biggest news story today here about the reduction in vaccines. And I know he spoke to the Washington Post today, so I'm curious, Secretary Weisman, can you give us an overview of what estimates for Pfizer and Moderna are slated for distribution in Washington by the year's end? Do you have any insight on what the problem is with the distribution, whether it's vials, dry ice, shipping, or manufacture? Do you have any sense of whether the state will recommend hospitals or other sites retain parts of their first shipment to ensure the availability of a second dose? And can you give us a sense of impacts on the effort to distribute to long-term care facilities?
Great, thanks for that question. Our staff indeed have been engaged with the federal government to better understand the situation. At this point, what we know is that we are expecting our full allotment this week. The rest of the allotment is en route or here at the moment in time, so about 62,400 doses. And for next week, we are understanding that we will be expecting to receive from the Pfizer allocation 44,850 doses. That's about 40% less than what we had expected. We're trying to understand exactly what that issue is about. It appears that part of the issue might be that we're going to be ordering vaccine earlier and wanting to make sure the supply is there, but we don't fully understand that issue. We do know at this point that we are only anticipating getting numbers sort of a week in advance. So while we had shared numbers that we thought we would get through the end of the month, at this point, we're unable to do that. We're really just unable to confirm the 62,400 for this week of Pfizer and 44,850. So our focus really is on the vaccine that's coming to the state to make sure that our healthcare providers and long-term care facilities are ready to receive that, and that we are ready to get these vaccines into people's arms and do the good work of what the vaccines provide. The governor mentioned that the Federal Drug Administration Advisory Committee has recommended moving forward with the Moderna vaccine over the next couple of days. That will play out much like it did last week with the Pfizer vaccine. At this point in time, we're anticipating that vaccine 128,000 doses for the next week, assuming that that is approved with all the regulatory authorities that it needs to be. So that's what we know at this point in time. We're closely following it, and we're in touch with our federal officials. We are prepared to receive whatever vaccine is available and to move forward with the good work.
I can add a little bit to that, Joe. obviously this is frustrating to us to, not have the shipment come when we were told by the federal government it was coming. But the good news here is there's no indication that there's some systemic long-term problem. Having the production that we need is the most important thing. We heard Pfizer today state that they have the vials in the warehouse ready to ship. They're just waiting from the orders from the federal government. That's really good news. It doesn't appear that it's a production problem, at least according to Pfizer at the moment. So we're hoping that this is a communication glitch. I told Austin Jenkins this morning, the only thing you can be sure of when you have a massive logistical efforts like this, you probably could expect some glitches. This may be the first one. We'd love it to be the last one while the communications are being established. But the good news is there's nothing to indicate a major lack of production here, which is the most important thing.
All right. Up next, we'll go to Essex Porter with Cairo. Go ahead, Essex.
Governor, on this issue of the vaccine, I know of at least one representative of hospitals who told me she was in tears to see your tweet to learn of this. It may not be a long-term problem, but your tweet really had a lot of frustration. And would you speak to the frustration you felt when you first learned that the allocation would be cut by 40% next week?
Well, I hate to think of a nurse crying. They've had enough tears already, and their heroism has been incredible through this. So I just hate to think of somebody in pain because of this frustrating information. So I really feel for that person because I know they've done so much for so many folks. What I would say is that, as I've indicated, I'm hopeful that this is an incident of some organizations perhaps not talking to each other as well as they should. There are two different organizations between the development and the vaccine in the federal government and one associated with its distribution. I'm hopeful that this glitch is a result of those organizations not coordinating themselves well enough. I'm hoping that they will resolve that very quickly and that the federal government will be very forthcoming on what they're doing about this. I have to tell you, I'm frustrated right now that that the administration has not explained this to us yet. That's frustrating to me. But given the moment we're in, I think it's perhaps my highest duty to give people hope and confidence. I do not have anything to indicate this is a long-term problem because the manufacturer of the vaccine publicly said they have the vaccine ready to go. They just need to get the orders from the federal government where to send it. If that is true, this ought to be a remediable problem. So I hope that nurse can take that and hopefully in the next few hours, we can get an explanation about how to work out this wrinkle. One other thing too, Joe asked about the long-term care facilities. We are very intent on getting the folks in long-term care facilities vaccinated early in this process. And I had a discussion with John this morning that if we do in fact have shortages, if in fact this does result that we have shortages from our anticipated deliveries, we need to continue our pre-existing plans for the long-term care facilities. We have got to get these people vaccinated. These are older, fragile people, and we've made that very, very clear.
All right. Up next, we'll go to Sarah Gensler from McClatchy. Go ahead, Sarah.
Governor Inslee, we're seeing some legislative leadership ask their members to streamline the bills they introduced or hear in committees this session. Do you feel that the virtual environment of the 2021 session might make it difficult to get the many policies you're proposing through? And if so, do you have any sort of strategy that you're funneling down to the legislature to address that?
Well, I've been a legislator in the State House and the Federal House, and so I've got some experience in this. I actually am quite optimistic the legislature is going to be able to do what they need to do. I believe they will find ways to do this in new ways. We have found remote communication has actually worked very, very well. Legislators themselves might welcome a little shorter speeches on occasion, and if that happens, they're going to get their work done. So I'm actually not. I know they're going to work out wrinkles in their process. That'll take a little bit of time, but I don't think we should trim our sails much here. We have big things to do, and I think we're going to get them done. I'm very excited about this session. I think the moment is a magic moment on progress in so many different things, from long-term health care needs to better education of our students, for a fairer tax system, to fighting climate change. All of those things are very achievable this year, given the recognition of our state of how we need to do big, bold things to save ourselves, and the fact that we have some new legislators who are going to make that possible. So I just can't wait.
All right. Up next, we'll go to Jim Camden with the spokesman review. Go ahead, Jim.
Governor, you described the capital gains tax that you're proposing as a way for certain high-income people to assist the state during the pandemic. Does this mean this is a temporary tax, or is this just the way to get the capital gains tax passed, then it will become a permanent part of the tax structure?
We're not looking at it on a temporary basis. These needs will be continuing. Our children are still needing education. We have mental health that we have to reform. Our housing crisis is going to continue for years. So it's not just a temporary proposal. And also, if we do bring more fairness to our revenue system, we certainly don't want to make more fairness just temporary. And this unfairness to working people, to make them shoulder the burden of taxes, has just been such an outrage for so many years. Our state deserves better. And to have the most unfair system, by the way, I forgot, can we put this chart back on? I wanted to show you something else too, just to show you why our state needs to make these changes relative to other states. If you compare us to other states, if you look on the left is the blue, you'll see the enormous distinction between the wealthiest person in our state, which is on the right, and a hardworking bottom fifth, which is 6 times. So the bottom fifth pays 6 times as much of their income as the top 1%. If you compare that to other states, a similar chart, Oregon, California, Idaho, you'll see relatively small differences across the gradients, the strata economically. So it is absurd for the state of Washington, best state in the United States, have a tax policy that puts this huge burden on working people. We've had enough economic inequality in our state. It's time for just a modicum of fairness. And we cannot allow ourselves to say we're 3 times more unfair than Idaho, for goodness sakes. So I'm looking forward to bringing fairness and justice to our system here.
All right. Up next, we'll go to Glenn Farley with King. Go ahead, Glenn.
How are you, Governor? So my question is really this. So hopefully this all gets worked out in the weeks ahead, and we will have months where we will be getting these vaccines, hopefully continuously. But what are we prepared to say we've seen these polls that say some people don't want to get it. These are largely national polls. I've talked to people who say, yeah, I kind of want to wait and see. But are you prepared to make this mandatory through employers or even employees of the state of Washington, that they get the vaccine?
No, I really do not believe that will be necessary, and I'll tell you why. I believe that some folks saying, well, I want to wait and see, this is new to me, that's understandable. I've seen sort of the interviews you and others have done with people stopping them on the street, and what a lot of people say, well, I want to see how it works out first. That's not shocking to me. This is a new thing. And what I believe is going to happen is that as we start to vaccinate thousands of people and people see their neighbors and their relatives and their coworkers getting the vaccine and they don't fall over in the street, but in fact they don't get COVID, that those numbers are going to increase dramatically of people who are comfortable for this. And I think this is like anything that is new to us. It takes time for people to become comfortable with it. We have become comfortable with vaccines in our society largely. These vaccination programs have been hugely successful in saving our lives, and I don't think there's any reason to believe this should be different. If anything, it should be even better given the terrific damage that people have seen to our society. Now, we're going to do our part in the state by sharing scientific information with Washingtonians so that they can make informed judgments. That effort has already started. You may have seen TV ads basically explaining how a vaccine works. And we have an extensive proposal to continue to share that information with Washingtonians. So I am very hopeful that this glitch that the federal government was responsible for is a temporary thing, and that they're going to get it fixed. And I'm hoping there's nothing nefarious about what's going on, and we will see success, and we will then knock down this pandemic. I believe that's going to happen, and the reason for that is I'm confident in Washingtonians. And that's not just because I'm governor and governors brag about their states. It is because we have demonstrated in our state already the recognition and acceptance of science and the willingness to follow it. We followed it by reducing our holidays in person for Thanksgiving. And as a result, apparently we have not seen the surge in our state that many other states have, because they have not had Washingtonians, and Washingtonians want to use their heads to try to save their lives. And we're doing that big time. We're complying with our mask mandates. We're doing the things to keep this pandemic restrained. And so that, to me, means we're going to continue to do smart things, and that includes taking the vaccine.
All right. Up next, we'll go to Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
Governor, in 2015, as you recall, you signed the Connecting Washington Transportation Package, $16 billion. It took a lot of work and set out a schedule for projects throughout the state. Your proposal today calls for moving up $724 million for culverts, which means $724 million worth of projects are probably going to be adjusted in the timeline. Which projects do you see would be the largest? Which ones will be moved? How will that be done?
Well, we have not made decisions in that regard, so I can't answer the question right now. But this culvert issue is necessary. This is a constitutionally required expenditure of the state of Washington. We cannot withdraw from that. We cannot shirk that responsibility. The courts have ordered the state of Washington to make these investments. And we don't have a choice on this. It is the right thing to do legally. It is also the right thing to do because if we don't do it, these salmon runs are going to disappear. And once they disappear, they don't come back. So this is both legally required, constitutionally required, and wise thing for all of us who believe that we want salmon in our rivers for the next few generations. And they are very much at risk. So I'm confident this is the right thing to do. By the way, we are making, I believe it's $400 million investment in our transportation package for maintenance of our existing roads and bridges. And this is critical. Look, there's nothing more fun than cutting a ribbon at a new transportation project. I enjoy it. But if you're cutting a road at a new bridge, but the road getting to the bridge is falling apart, you haven't solved the problem. And we have significant outstanding maintenance needs on our roads so they don't fall apart. And this is one of the biggest steps forward to take care of our maintenance needs.
All right. Up next, or actually, David, did you want to answer that one?
Schumacher, do you want to add anything to that?
Nope, I think that was very good.
Up next, we'll go to Patrick Quinn with COMO. Go ahead, Patrick.
Just to jump on this vaccine issue one more time, hopefully to put it to bed, but I just wanted to clear up the 40% less. I know you have said this is not going to be a long-term issue, and maybe Dr. Weisman, you can chime in here as well, but does that mean it'll be 40% less next week and the following week? And we just had to kind of clear up how the different sides were communicating what was available versus maybe what was ready to ship. And so if there is a change in numbers long-term, have y'all changed who will be prioritized in 1A? I know it sounds like you guys are still focusing on long-term care facilities with that conversation this morning, but will this change inevitably have to change how even healthcare workers who are facing the virus are prioritized?
So what we know at this time is that next week we'll receive 44,850 doses of the Pfizer vaccine. We have no information yet at this point on the following week after that. We're understanding that we will learn that a week in advance. And so I think we'll have much more information at that time to better understand what the full situation is. As I said, with the Moderna vaccine, assuming that's approved, we believe we'll get 128,000 doses in that first shipment. So again, a lot more vaccine on the way, and our work with the federal government is ongoing to make sure we understand exactly what the allocations will be. And I do believe from my conversations that they're looking to get a regular sort of number that we can count on weekly. We just need to make sure we understand what that is.
All right. Up next, we'll go to Casey Decker with CREM. Go ahead, Casey.
Hello. My question was actually addressed earlier.
Thank you.
Awesome. After that, we will go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, Governor. I'm curious. Representative Noel Frame recently said that capital gains tax proposal this session the idea behind that would be because of the expected legal action that could play out over the next couple of years. And then in 2023, the legislature would know what they have to deal with. I'm wondering if that's your thinking on this as well. And if so, what does that mean for your budget?
I'm not sure what you're saying there. Could you run that? I'm not sure what you're suggesting. Could you try it a little different way there?
Sure. Representative Noel Frame had said that there would be a proposal for a capital gains tax this year, but that because of the expected legal action due to many believing it's an income tax, that would be caught up in the courts for a couple of years. And then that way the legislature would be able to tell in 2023 whether, because the court process would have played out by then, what they have to work with in 2023. In other words, you would be able to use that money and use it in your budgets in 2023.
Okay, I think I understand. We're not waiting for judicial review on this. We are proposing kicking in the capital gains tax in the second year of the biennium because it takes a year to stand up the procedural mechanisms to put it in place. That's why there's a year wait. It's not related to judicial review. We believe we are on extremely sound legal ground on this. It is not an income tax. We believe it is a constitutional exercise of legislative authority, and we believe very strongly that it will be held eventually by the courts. We see no reason to wait in its implementation. So we're proposing implementing it as soon as we can procedurally stand it up, which is the second year of the biennium. And we're confident that's the right way to go.
All right, we've got time for just a couple more. Up next, we'll go to Liz Birch with Coin. Go ahead, Liz.
Hello, Governor. Thanks for taking my question. So I want to come back to the tweet from this morning about the 40% reduction. I just want to be clear. You said no explanation was given by the CDC. You're saying you've had no follow-up from the federal government at all about this, no follow-up conversation with CDC since that was tweeted?
Correct. We have attempted to obtain any degree of explanation for this through multiple channels, including John calling his contacts. It includes my office in Washington, D.C., making inquiries of the federal government. And there has been no explanation offered whatsoever. That is surprising to me and frustrating, and I'm sure it's frustrating to Washingtonians not having an explanation for this. So I can't posit an explanation. What I can say that if the production is as we anticipated, which according to Pfizer, that is happening, that there should be no reason eventually getting these doses in the supply chain. So that's the good news. And I'm hoping that this is simply a communication mix-up between two agencies in the federal government that can be resolved fairly quickly. Now, you know I have not been reluctant to criticize this current administration. At this moment, I think it's more important to express hope that this is going to get resolved than outrage. So I'm just expressing a hope that this is resolved and we do get an explanation as soon as we can. I think it'd be very helpful to everyone if they can, and we'll continue to ask for it as quickly as we can.
All right, and time for one last question. We'll go to Melissa Santos with Crosscut. Go ahead, Melissa.
Hi there, Governor. My understanding from your press conference Tuesday is that your cap and trade or investment carbon plan thingamadoo was going to pay for the working families tax credit as well as some of these other investments. But that cap and trade or doesn't sound like it's going to bring in any revenue until the biennium after this coming one. So how would it pay for these investments, especially the working families tax credit, if you aren't getting any money from it for another 2.5 years?
Well, obviously, those expenditures that flow from that revenue source have to wait to that period of time. And what we have suggested that there are a number of things that we believe that can finance, including the working families tax credit. We believe it could also be available for transportation funding. And we're leaving this open for the legislators to work their magic to figure out the best investment of that pool of funds. We will suggest to them the working families tax credit and a few other things, including transportation funding. But we've left that open for the legislators to come up with their own druthers on, and I will work with them in that regard.
David, did you have anything you wanted to add on that?
No, just that any of the expenditures of that revenue that comes from that would all be for the second biennium, whether it's transportation spending or working families tax credit or the other uses. So those are not spent in any way in this budget proposal, but would be part of our 4-year budget thinking.
Any closing remarks, Gov?
No, except I'm looking forward to everyone engaging in this discussion. We have big things to do this year. I believe we can do them. I am thrilled that we have vaccines that I believe are working today in our state, which is a great thing. I hope people will share my view that confidence that these are going to get delivered and that this hiccup is going to be resolved, and I hope people share that to tide them over until we get an explanation from the federal government. I think that'll serve us well in the next few days. So I thank everyone for their confidence in Washington. That's what I have. And let's make sure it comes to pass. Thanks very much.